health, particularly on the effects of climate change on the prevalence of non-communicable diseases in the Caribbean. This is why she pursued a master's in public health from the University of Edinburgh. In her spare time, Julie enjoys singing, going to the beach, and slow mornings. She is also the proud mother of a 9-year-old girl. As she just stated, Julie was diagnosed with PCOS 11 years ago, and now we're going to be sharing her presentation. Okay, so everybody in the chat, can you please give her a warm welcome? Give our sister a warm welcome. Can you see my screen?
Okay. Good afternoon to everybody. I'm happy to be here. Thank you for having me. Thank you, Melanie, for the introduction. My name is Jolie, and I will be sharing my experience having polycystic ovary. Next slide, please.
Yes.
So who am I? I am 28 years old, and as mentioned, I am a science teacher. Although I have a passion for the sciences, I am also very passionate about public health. I am also a nature lover, and I am a mom of a 9-year-old girl. In the picture here, I have my shishi. And I was diagnosed with PCOS at 17 years old. Next slide. Because it has been such a long time since my diagnosis, I have separated my presentation into then, which was when I was diagnosed, and now. So 11 years ago, I began experiencing irregular periods where my period came every 2 to 3 months. Out of my mother's concern, she urged me to go get a checkup, go to the doctor, and that is when I was diagnosed with PCOS. Right now, with living with PCOS, it has affected me in terms of the length of my cycles. So for example, I will only experience a period after 35 to 40 days. I would experience very heavy bleeding when the period does come and unbearable pain. And throughout the month, I would also experience a large amount of fatigue to the point where completing small tasks at home, like doing the dishes and cleaning the home, I would have to take breaks every time I complete a task. So I would not be able to remain active for extreme periods of time. In addition to that, I also have experienced an increase in the amount of body hair that I have. So I have noticed an increase in the amount of hair on my chin and on my chest. Next slide, please. When I was diagnosed, not knowing very much about PCOS, I had immediate concerns about my ability to have children because in the counseling session that I had with my doctor, he explained that it would have affected my fertility. And I also had a sense of uncertainty about the quality of life that I would live in the future. I was not sure how this disease or this condition would have affected how well I could have performed or be active as a young person, only now coming out of adolescence. So that sense of uncertainty was a bit worrisome. Right now, I am affected, I would say, mainly by PCOS in terms of having unpredictable and heavy periods. So that has affected my social life in that once the period is on, I don't want to go anywhere. I don't feel like leaving the house in fear that I have an accident. So that has kept me away from a lot of events and a lot of activities that I would have wanted to participate in outside of the home. And just not knowing when the period will come has brought that sense of paranoia. But it's something that I try dealing with. In addition, having the PCOS has affected my professional life to a smaller extent. in that when the period is on, sometimes I experience such unbearable pain that it's difficult for me to get through the work day. So there are many occasions where I go to work and I have to leave early, or I cannot go to work at all. And just trying to get tasks done and meeting deadlines, etc., can sometimes be difficult, especially during the week that my period is on. Next slide, please. My experience with medical professionals upon diagnosis, the treatment was neutral. And here I deliberately included a picture of a male practitioner because I was diagnosed by a male. And in preparation for this presentation, I was reflecting on that day when I found out and how I was treated. And I'm not sure, this is just from my reflection. I assume maybe because it was a male, my treatment was very neutral. It may have also been because of my age. The practitioner did not go into too much depth in explaining to me what the condition was and how it could have affected me outside of fertility. So right now, I am assuming these may be some factors that had affected how much information that I had at the time. There was no signs of concern or medical urgency from the doctor. I was diagnosed after an ultrasound was conducted, and I was counseled about my fertility. Next slide, please. Right now, with my current OBGYN, I recently switched OBGYNs because of access and change in living location. But when I explained to her that I had PCOS, she did not seem deeply concerned. She took note of it, but she did not say anything about it. And many times when I visit her, we often discuss recommendations as to how I could manage my irregular periods. In general, I would say that my experience with doctors have been caring, and it has been positive. And again, reflecting while preparing this presentation, I am not sure if my current OBGYN was not deeply moved, I don't know, by my diagnosis because I have already had a child, and initially the impression was that it would affect my fertility only. I'm not sure. Treatment from friends and family. When I was diagnosed, my family was very relieved. My mother, who was the one who was very concerned, she was happy that she knew what was going on. She was satisfied in knowing that, hey, we know what is causing this, and we know how we can go about maybe treating it at home and remedying it when the period comes or leading up to the period. With my friends, I mostly kept my diagnosis a secret because I did not think it was something that they could have related to. I did not get the sense that it was something that I should talk about, really. So those that I did choose to share my diagnosis with were often very supportive and spoke positively about my future. All the concerns that I had, didn't worry about it, things would be okay. And so I was grateful for that. I remember I had gone to a class while I was at A level, and there was this lecturer that I was particularly close with, and I mentioned to her that I was diagnosed with PCOS. And she gave me the story of her sister who had been diagnosed in her teens as well, and how her sister was doing so well, and her sister had recently had a baby. So I should not dwell and try to be too hard on myself about it. So I was grateful for her and for her sharing her story. And right now, I would say my partner has been very, very supportive, and he often reassures me that many women go through what I am going through. He would use the word normal a lot, like, Julie, worrying about that, that's so normal. So many women are going through that, and that there are people out there that are willing to help you and listen to you, and there are solutions to some of the issues that we sometimes think are unresolvable. So, for example, I know the facial hair can sometimes be a big deal, but there are solutions and there are ways to get rid of the facial hair. And sometimes it's not as bad as we think it is. Right? Next slide, please. So I've divided my tips and other useful advice into two. I would first like to give tips to my fellow PCOS sisters. I would like to encourage you to learn as much as you can about PCOS, what it is, what the symptoms are, how you can treat it, whether it be at-home treatment or over-the-counter treatment, ask your doctor questions, etc. And this will allow us to empower ourselves and to remember that we are not experiencing this alone. Also, I would try to surround myself with positivity and like-minded people. So this event and this group of sisters and community is a very good example of how we can surround ourselves with persons who will encourage us and reassure us and make us feel comfortable to speak about what we are experiencing and always try to offer solutions. I would also like to remind you to be kind to yourself um, and that you are not alone. Next slide, please. And advice to the loved ones of the sisters. I would like you to encourage them to get to know about their condition and you too to get to know about their condition so that when they may be experiencing certain things, you can understand what they are experiencing and try to support them, right? Encourage them to embrace the diagnosis and to speak positively about their future, the concerns that they may have, try to address it in a positive way and to reassure them that you will be there for them to support them. And be mindful of their experiences. Sometimes some of the symptoms that we experience, we cannot relate it to other persons. But if, for example, we decide that we cannot make it to work today, please don't be hard on us. Try to be mindful of our experiences and to support our decisions. Next slide, please. So this is the end of my presentation. Thank you very much for listening. If you would like to speak to me a little bit more about my experience or share anything at all, you can contact me via email.
Thank you so much, Julie, for your amazing presentation. I think everybody here is showing you support and they really enjoy the pictures from the slides. But most importantly, thank you for being so wonderful and so open with us and sharing your story. There are so many points that I would love to touch on and questions that I'd like to ask you. But remember, our question and answer segment is at the end of the presentations. So if you have any questions that you'd like to ask, feel free to post them in the chat and I will make a note of them and we can ask our presenters at the end. But before we go to the question and answer segment, we are now going to present our second speaker, who is, let me make sure I get it right, with the pronunciation and everything. Our second speaker, who is Dr. Lucilla Charles. Please make sure that I'm pronouncing it correctly, Dr. Lucilla Charles. So I am now going to just go through her bio. So Dr. Lucilla Urban Charles is an obstetrician and gynecologist with 19 years of experience in the field. She pursued her undergraduate training in Cuba and postgraduate training at the University of the West Indies, Mona Campus, Jamaica. She is the former head of department at the Owen King European Union Hospital, formerly Victoria Hospital, where she spearheaded support efforts for birthing people, particularly those delivering through cesarean sections. She is the immediate past president of the St. Lucia Planned Parenthood Association and collaborates with the Pan American Health Organization, PAHO, as a temporary advisor conducting perinatal audits in several Caribbean territories. Dr. Childs is passionate about delivery of service and is the proud recipient of the St. Lucia Medical and Dental Association's People's Choice Award. So now in the chat, can you please extend some warm welcomes to Dr. Lucilla Charles?
Thank you. Thank you very much. Is my volume good enough? Okay.
Yes, we can hear you.
Okay, excellent. So this discussion this afternoon, everyone is aware, is about PCOS or polycystic ovary syndrome. And we call it PCOS in the medical fraternity. I think persons also do this in the lay persons as well. Okay, so the intention for today is to discuss the points which were requested of me, to look at what is PCOS, look at the causes, also to discuss the signs and symptoms. And I saw that the previous presenter had gone very well into discussing her own experience, the diagnosis, as well as the treatment. So this should be the next slide. All right. So we'll take one point at a time. Next slide, please. So what is PCOS? I think everybody knows by now it's a very common condition, which spells out as polycystic ovary syndrome. And just to break up the words here, poly meaning multiple, cystic referring to the cyst seen on the ovary when we do ultrasounds, and syndrome meaning that it is a cluster of issues. You know, I mean, there are conditions which are just a single thing, but polycystic ovary syndrome is a cluster of symptoms and signs and conditions, and hence the reason for the term syndrome. So I put it in point form so we can look at each of them individually, but it reads out like this. PCOS or polycystic ovary syndrome is common. It is complex, it's serious, it has a genetic component, hormonal component, metabolic, reproductive, and a huge psychosocial component. And what's quite concerning about it is that it's a lifelong disorder affecting women of reproductive age, but it does not stop just at the reproductive age, you know, limit. It extends, or the effects of it can extend even beyond that. And, you know, I always like to say that when a woman is affected by a condition, so are the individuals in her life and by extension, society. So let's look at each of them. Common because it affects as many as 20% of women. And to translate it into numbers, World Health Organizations looked at it as a good 120 million women worldwide. Now that there is an underestimate, because a lot of times women go around with PCOS undiagnosed. They don't know that they have it as yet. And so the numbers will not reflect who the persons were truly affected. So in other words, it's millions of women. And in my practice, I see on a very regular basis, a lot of women who are affected by PCOS in some way or the other. It's complex, and I'll tell you, it is a very difficult condition. It has taken the health fraternity, it has taken the masterminds a lot of years trying to, unravel the condition of PCOS. It is not a simple, I don't get my periods or I get acne. There's so much that has been understood and that is still yet to be understood about PCOS. It is serious because it causes some short-term stress to the patient, but some long-term very serious conditions like cancer. There's a huge genetic component, meaning that it can be passed on through families. So one can see it in a cousin and a sister, and my mother or grandmother had it. It's hormonal because center or part of the interplay is the hormones of that woman not functioning as well as it should. Metabolic because it can provoke conditions like high blood pressure, diabetes, but also these conditions can lead to polycystic ovary syndrome. Reproductive, and that's a very huge part. Without reproduction, we will die out as a species. And so it really threatens the ability of a woman to conceive. Psychosocial, and this is the part when I went to medical school some 20 something years ago, there was very little mention. And I don't remember. I mean, I'd like to think that I learned well. There was very little to no mention of the psychosocial impact of PCOS, and by extension, all conditions. Whenever someone has to deal with an issue, whether it is short term or long term, it will create an impact on the psyche and also her social. And the presenter just before me spoke to some of how much it affects her quality of life. Sorry. And then, of course, it's lifelong. So, polycystic ovary syndrome is not a day event, it's not a month. It is year after year, and then untreated, it gets worse. So it is a disorder of reproductive age, meaning women who are anywhere between 15 and 44. But as I said, it can extend beyond that. And if you look at the little insert I have here, that domino effect, because one thing leads to another and another and another. And that's what makes PCOS so complex. Next slide, please. So the causes. Next slide. I will tell you that, and this is why I said it's complex, trying to understand why women develop this condition, there's still lots of questions left unanswered. And admittedly, there's been a lot of headway over the years in understanding why women get PCOS. So, I mean, they've moved away from thinking it was just obese women, or it was just women who had a certain family trait. They recognize that even having none of that, being lean and being healthy and moving around and eating right, one can still develop polycystic ovarian syndrome. So I always like to show for photos. So if you look at that big question mark, there's still a lot unanswered. And while a lot is being understood, it is not 100% sure why women develop, but a lot of headway has been made. So if you look at the diagrams to the right of the screen, it's very interconnected. So there's the term of, androgen excess, androgens referring to the male hormones. Now, we as women, we must have a little male hormone. It is necessary. It helps with egg development. It helps us to feel well. It helps with brain and just concentration. But when it is found in too high a level, it leads to very unsavory effects. And we will see some of them, and our presenter mentioned them. But these are interconnected, because if one has a challenge with managing the insulin, what is called insulin resistance in the body, it can also lead to androgen excess. So insulin, and I'm sure most persons would be aware, is that hormone in the body which helps to take the food, the energy that we gain from the food that we eat, or the sugars, and pass it on to the cells so the cells can become useful. But then if there's a resistance, if there's a block, the sugars in the blood will get higher, and the more blockage, the more insulin is being released by the body trying to counteract that resistance, and then leads to further problems. These high male hormones, again, impacts on the ovaries and leads to the polycystic ovary condition. Inflammation, and that's the part which was not well elucidated back when I was a medical student. So inflammation was not so high on, but they're recognizing that there are a lot of inflammatory reactions which occur from environmental things, for example, even insecticides, smoking. For those who smoke actively and for those who are secondhand smokers, one can develop inflammatory, but even the foods that we eat. So this is why, diet is such a huge component now of the management, because when one eats something that the body deems inflammatory, meaning creating a reaction where lots of substances are released and it almost attacks its own cells, like gluten. it can lead to polycystic ovary syndrome, but not isolated. And of course, things like even the microbes, they are looking at even the microbes in our gut, the microorganisms, the bacteria, whether it is replaced by foreign bacteria, that can also lead to. So it's a real interlocking. And if you look at the little insert I have there, eventually what most persons focus on are all these little cysts in the ovaries. Yes? Next slide. So the signs and symptoms, and this is when I joined the presentation. Next slide. Signs referring to what the individual can see, and symptoms, what the individual experiences. Very, very common. And I think that's one of the things that most women recognize as being a problem and why they present irregular periods. So we are designed to have a period on a monthly basis. And it's a bit of a bother, admittedly. Every month, women bleed. But then it's a sign that all is well. And so if a period does not show up, for those who are sexually active, the first concern is, oh my goodness, if you're not looking forward to it, is, am I pregnant? Holding your breath. And if you're hoping, then you say, okay, fingers crossed, maybe I'm pregnant. But outside of that, if you know you're not pregnant and the periods are missing, then it starts to create concern. So that's one of the classic forms of presenting periods that become progressively irregular. So women will start missing maybe a period and then maybe two. And there are women who have gone months, 8 months out of the year without a period. Sometimes they go years if left unchecked. Or they may have, conversely, periods that are lasting very long. Because one of the things about polycystic ovary syndrome is that it gives you a variation, a wide fluctuation of symptoms. So persons may come in and say, I'm getting my periods very frequently, or I'm bleeding very frequently. And when they bleed, especially if there's a prolonged period of not getting those bleeds, then it's almost like the monsoons. The bleed is relentless. And there are persons who very quickly can bleed for weeks. And of course, the impact of that, low blood counts, not having the strength to move around and do basic functions. One of the things that women also experience, which is very disconcerting to them, is the signs of the high male hormone. And I saw the previous presenter in talking about her own experience, spoke about the facial hairs or male pattern hair growth, which looks good on the males, but not on us. We are not designed culturally to have so much hair. So women with polycystic ovaries, quite interestingly, yesterday I went into a store and there was a young lady serving and she had almost a full beard. So there's hair on the lip, beard, sideburns, also acne, hair on the chest, hair around the nipples, sometimes excessive hair on the lower belly, even on the lower back, the thighs. And of course, one can understand how, it can impact one's self-image. During the pandemic, I think a lot of women who, suffer from those, just ill results of the high male hormone were happy to wear their mask because, of course, nobody would see that they either had hair or signs of having removed the hair. Hair loss. When it's really bad, women may actually go bald. And that is unsightly. That is very disheartening to women because hair for us is important. And if you're starting to develop a patch in the middle, you can understand. It leads also to, difficulty getting pregnant. And that is one of the things that also drives women into seeing their physicians, because if a certain number of months and sometimes years have gone by and pregnancy is not successful, then it leads, especially as the years increase, we start hitting the high 30s, women get very, very worried. So it robs persons of that opportunity. It also leaves them with multiple little cysts on the ovaries. And I think that's the part where, a lot of women are concerned that they have some big cysts sitting in the bellies. But I will, on one of the slides, show you that it's actually much smaller than persons think. Eventually, persons who may get pregnant may actually lose their pregnancy. And that is even more damaging because after maybe having tried for so long, then one loses the pregnancy. And of course, all the psychological aspect of it, anxiety and depression and lost productivity. I mean, it's just a ball of issues that women suffering with PCOS encounter. Next slide, please. I wanted to touch on the long-term impact of PCOS. So in addition to the things that I mentioned on that previous slide, women with polycystic ovary syndrome may develop diabetes because of that high level of blood sugars and the insulin resistance. And diabetes, again, is a domino effect. It affects the brain, it affects the eyes, the risk for strokes and blindness and eye disease and kidney disease, and you get it. It also increases the risk for heart disease. So women who are fairly young in their 50s and 60s may end up having heart disease because of having had PCOS. There's the risk for obesity, but not just any type of obesity. It's the obesity or the fat of around the middle. So the bellies may get, and it's quite upsetting to women because they think, look, I am doing the right things, but my belly keeps getting bigger and bigger. So central obesity or the belly obesity is associated with, again, the high blood pressure, the high blood sugars, as well as increase in the cholesterol, what is called dyslipidemia. And that leads to, again, all of these other conditions. For women who put on a lot of weight, they can also have trouble sleeping, where there's this cessation of breathing, which can occur. It's called sleep apnea, obstructive sleep apnea. So women may fall asleep and then stop breathing, and it leads to very poor sleep experiences. And again, even their offspring and then can be exposed to the ill effects of it. So diabetes, childhood diabetes, and the risk for developing polycystic, even neurodevelopmental issues. But one of the things that, is quite alarming is that for women who, especially those who go many months without having a bleed, especially if the lining of the uterus is building up and building up, it can increase the risk for the glands becoming cancerous, endometrial cancer, or the cancer of the lining of the uterus. And that's at sometimes a fairly early age. I remember many years ago, there was a patient who was fairly young. She was only in her 30s, and she had endometrial cancer because of a very long-standing history of polycystic ovary syndrome. And then, of course, the anxiety, the depression, even psychosis. There are women who will flip over into frank psychosis of literally becoming crazy because of all that polycystic ovary syndrome has done to them over the years. And then the risk, the reduced quality of life, as our presenter was saying, not being able to go to a function or go into a function and having to leave because, again, of the unscheduled bleeds, or feeling uncomfortable because the face is scarred with acne and full of hair. Next slide, please. So how do we diagnose? The word diagnosis for us doctors means trying to understand what is happening to the patient. And in medical school, we were taught to do so in three ways. One, to get a history. In other words, listen to the complaints of the patient, what she's coming in with, to examine the patient, and then to do additional tests. So as it relates to polycystic ovary syndrome, sometimes a patient just has to walk in, like the lady I saw yesterday at the store. We take one look, and while there are loads of other reasons why a woman may get acne and facial hair, it's generally right there on the mark when we see a patient walking and her face is scarred with lots of acne, or she has, a darkening of around the neck, which is a sign of the insulin resistance, or she has, that aspect of being extremely big around the middle. We could just look and spot diagnose and say, hey, this lady most likely is. But then the history, so she will give the history of the menstrual irregularities. Give me the next slide, please. She will give the history of the menstrual irregularities, missing periods, not having periods for months on end. She will give the history of having to deal with, lower abdominal pains because the ovaries get a little bulky, a little fatter than they should be. It sometimes leads to pain. She will give you the history of battling with hair and acne and depression, and just feeling that she is not a female, and then very, very, very significantly having difficulty getting pregnant. One of the things that I used to say polycystic ovary syndrome is such a horrible condition, but the only thing it may do, which is sort of positive, is that because of the excess androgens, the excess male hormones, it may actually improve on her sex drive, her libido. So women with polycystic ovary syndrome who have excess androgens may actually have a very intense sex drive and may enjoy intercourse. Sometimes their partners may not be able to keep up. But the downside of it is she may be continuously bleeding. She may not in all of this intercourse may not even be getting pregnant. So then it leads to, again, psychological effects. There are women who, on the other hand, may have a very low libido, particularly those who have polycystic ovary syndrome, which is not associated with an excess in the male hormones. They may complain that their libido is almost non-existent, and particularly if they are doing certain treatments, it may also affect. If you look on the right side of the screen, you'll see, this is an ultrasound image of the ovaries. Now, the ovaries, we know, I think most persons dominate the knowledge that we are born with all our eggs as women. We have them from the moment we are in the uterus. And over the years, we lose a bunch of them, but several of them get the privilege of being released once a month, and this is called ovulation. The issue, or one of the issues with polycystic ovary syndrome, is that because of all that is happening, including the excess androgens and the insulin resistance, ovulation does not occur. And this is why the periods may go missing, but this is why we see all these little eggs in there. So persons come in and say, they tell me I have cysts, and they think these are big things. They're actually those eggs which never opened up. So they are less than a centimeter. Generally, there may be more than 10 in one ovary. And at no point we should have more than one egg visible in the ovary on an ultrasound. But if you look at the image, you'll see several little eggs. So they call it like a string of pearls, or the pearl necklace effect. And so you see all these little black pockets. All of these represent eggs which did not get to their full potential to ovulate or to release. And so all those months that this lady may be having a period, she may not actually be releasing an egg. And this is one of the reasons why getting pregnant is a challenge. There are also blood tests that we can do in the investigations. And it's something I don't typically do, because once you've seen you've heard the history and you've examined the patient, I don't know that there's too much more to do, because it takes a lot of money. And most times these results, they are normal. So we look at hormones like the luteinizing hormone and the follicle stimulating hormone. We want to see the ratio between them. We may look at the testosterone, but I will do those mainly for a woman who does not have any obvious signs. And then I'm thinking this is still polycystic ovary syndrome. One of the things I like to do is to look at the lipids, as in the fats, and also look at her blood sugar level, because again, of the ill effects, the long-term ill effects of polycystic ovary syndrome. The blood test, they are very expensive, and so I don't think it is necessary to do, in addition to the ultrasound, do all of the blood tests. But one of the things that help us know is to put this lady in what is called a criteria, where we must have 2 out of 3 things. If she's having irregular periods or difficulty getting pregnant, and she has signs of the high male hormone via the acne and the beard, and then an ultrasound done shows that she has multiple cysts, 2 out of those 3 things is sufficient to say if we have excluded other causes that she has polycystic ovary syndrome. Next slide, please. So it comes down to management. And management of polycystic ovary syndrome is just as complex as the reason for it, or the causes, or the pathophysiology, as we call it. It requires a good understanding from the side of the physician. The healthcare provider must understand the condition before one attempts to. And I listened as the presenter said, the doctors sometimes don't show enough empathy or understanding. And because it's very complex, I can tell you it takes several readings to try to understand what is happening, which is going to guide treatment. It requires a multidisciplinary approach. You see, polycystic ovary syndrome is not just for the gynecologist. We come in and we have a huge role to play, particularly for women who have the menstrual irregularities, or women who are attempting to get pregnant. But then we need other individuals. We may need a dermatologist, particularly for the lady who has really bad facial hair or bad acne. She may require additional treatment. We may need the psychologist because the huge component of creating a lot of anxiety in those women, we definitely need the psychologist. And of course, we will need our ultrasonographers. So it's multiple individuals, maybe an endocrinologist. These are the doctors who deal with organs like the thyroid gland to come in and help us understand and to help treat this patient. And very importantly, your nutritionist, your dietitian, because diet is a huge component. So it's multifaceted, it's multi-layered, multiple hands must be involved in the care of the patient. Education, and I heard the presenter before our patient say that you need to understand what's happening because polycystic ovary syndrome is so complex and it causes all of these grievances. The physician must understand, but the patient has to understand what is happening in her body, which is going to guide her into sticking to some of the advice that she gets from her physicians and understanding why her body is transforming, not just educating herself, but educating her partner, educating her family, educating her co-workers, because all of these individuals form part of her circle. And because polycystic ovary syndrome is not silent, it's a very loud and aggressive condition. It lets people know your business because it's right there on your face, right there in the middle. I mean, it requires that all of these individuals have an idea. Now, we are not in the dark anymore. There is a lot of information available, but I think healthcare providers, nurses, and doctors must ensure that they first understand the condition and help the patient understand what is happening to her. Now, when we treat conditions, we look at the core problem and then we look at the symptoms. So when we manage a patient with polycystic ovary syndrome, the question is, are we dealing with the skin issues? Are we dealing with the menstrual? Is it a fertility? And so we will target our treatment based on this. So there may be things like medications that we will need to use. Even supplements may need to be used, like magnesium and vitamin D. And these were things that were not taught to us when we went to medical school, because it was not known then that these supplements play a huge role in managing the patient. Dietary and exercise, that's the cornerstone. I'll tell you, it is not easy. Once I sit with a patient and I say, I can give you medication, but it may not get rid of the polycystic, because you can't really get rid, you can just control it. It's like any long standing condition, any chronic condition, it requires constant management. So I say, you must watch what you eat. Now you see this beautiful pink Rolls Royce. I say to my patients the analogy that our bodies are like machineries, and they are. It's the woman with polycystic ovary syndrome has a high-end vehicle like this. Her body is high-end. It requires a lot of maintenance. It requires a lot of, selected ingredients to make it work. And so if you put anything inside this vehicle, say, for example, this is run on diesel, and you put gasoline in it, it will destroy it. So the woman with polycystic ovary syndrome may not have the leeway of eating her gluten or enjoying her cheesecake. She may not be able to do like everybody else at the fete and drink down her alcohol, because she will be, of course, kicking off all these inflammatory issues within her. So diet is a huge part. And I have seen over the years that when persons make a very concerted effort to select how much they eat, how frequently they eat it, the portions, and they get active, those who can, they recognize that there's a huge improvement in the symptoms. And even pregnancy may occur. Now, one of the things I want to highlight here about pregnancies that, I have a lot of women come in alone and saying, Doc, I know I have the polycystic ovaries, so it's me, I'm not able to get pregnant. It's very important that we must remember that, yes, you may have polycystic ovary syndrome, but we also need to know that the male counterparts are healthy, and it's a sperm count. A lot of times individuals, the males give so much trouble, and the women already have blamed themselves thinking it's just them. So it's just a pitch in there to say, if you are having difficulty getting pregnant and you have polycystic ovary syndrome, it does not mean that it is all your fault. You must bring in the male so that we can get enough information to guide as to, getting that sperm count, and then of course dealing with the individual issues for the woman. So there's a point here which speaks to surgery. Do women with polycystic ovary syndrome need surgery? When I was a medical student, it was a thing. They thought that if they cut off a piece of the ovary, they would release those eggs. But they came to realize that when we go in and cut a piece from the ovary, which is called a wedge resection, we're actually doing more harm than good. It causes scarring, it causes further difficulty, by preventing the egg from being picked up by the tube. And so surgery is last resort, unless this lady has a massive cyst, which is not typical for polycystic ovary syndrome. The psychological support is crucial for herself, which is one of the things I really enjoyed hearing when our presenter said self-care. Be kind to yourself, teach yourself, recognize that you did not make your body, recognize that you have a condition and it can create a lot of issues. And so you must make a concerted decision to first and foremost be kind to yourself, learn about it, and then take each step, one single step at a time, in trying to keep the condition under control. And of course, if needs be, speak to other individuals, persons that care about you, individuals who are trained to guide you so that you can help your mental health, because it really does cause a lot of mental health issues in women. Next slide, please. Okay, so this is the end of my presentation. There's hope. There's hope for women with polycystic ovary syndrome. I'll tell you, because when I was a medical student some 20 years ago, the understanding was that pregnancy was not possible. It was just women who were obese. And there was very little talk about, other components like the inflammatory, even the microbes of the gut, and how certain just environmental toxins can impact and cause polycystic ovary syndrome. There are now innovative ways of looking at it, even transplanting gut microbes, looking at adding, medication for the high cholesterol, and ensuring that women who have PCOS get psychological support, and that fertility is possible. It is very possible, but of course, early diagnosis and intervention is absolutely necessary. Thank you very much for your time.
That was amazing. Thank you very much for your insightful presentation, Dr. Lucilla Charles. I learned so much, especially about the size of cysts. I never even knew that was a thing. So that's definitely something I want to learn more about during our question and answer segment. Those of you who have questions, burning questions, and you would like to get them answered, please feel free to tap them in the chat, and I will be sure to add them to our question and answer segment towards the end. Now, moving on to another presentation, we have Beverly Ann, who is joining us from New York. And now I'm going to read your bio, so hopefully you're ready to present. So, for those of you who don't know, Beverly Ann Hippolyte is a senior research analyst at a private consulting firm based in the US. She previously worked as a credit risk analyst at the St. Lucia Development Bank before she completed her master's in international development policy in May. Whew, that sounds complicated. She is a strong believer and advocate in women's rights and volunteers with the Ionola Womanhood team as a research assistant. She also is a strong advocate for ending violence against women and hopes to contribute more in this field in the future. In her spare time, she loves to exercise, read a good book, and watch tennis. Now, let's welcome Miss Beverly Ann Hippolyte. Everybody, please give her some applause in the chat. We're so excited for your presentation.
Thank you. I'm supposed to have my background, but Zoom is giving me a hard time, so I'm gonna just have a plain background. I just want to say that the presentation made before me by Dr. Charles and by Jolie was really informative. I'm not even sure what more I could say that would, wrap up this presentation portion of this webinar. Some things will be repetitive, but I think repetition helps with increasing understanding and kind of solidifying information that you've already taken in. So we might as well hear some of it for the third time. So I'm going to just give some information on how we can create a more safe space for women with PCOS. I'm not I don't struggle with PCOS as far as I know. However, I do know that in my experience, when I started getting periods, there was some irregularity with my own periods. And I definitely developed facial hair when I was at school, and I always wondered what these things were, a sign of, but the lack of knowledge and information that my mom had and myself never really dealt with it until I realized that I may have had a cyst on my ovary, which I've since dealt with. We can move on to the next slide. So we will start off by really talking about some of the challenges that women have faced with reproductive illnesses, specifically PCOS. Um, but a lot of women who struggle with diseases, reproductive diseases, will tell you that these challenges are intertwined no matter what they're suffering with, um, whether it be endometriosis or adenomyosis or fibroids or PCOS. A lot of the challenges are the same. Next slide. So one of the things that we want to highlight is the stigma and discrimination that women with PCOS struggle with. A lot of the presentations before really highlighted how, a lot of women on a daily basis deal with so many things in their daily routines that are connected to the diseases that they struggle with. And some of these include, feeling like they're not worthy of motherhood and romantic companionship, unfortunately, because of the amount of value that society places on that and the pressures to be a mother and to have a partner. Women, struggle with the additional pressure to fulfill, these roles. And when they are compounded with the issue of fertility and dealing with reproductive illnesses like PCOS, that then diminishes how they feel in terms of being able to be mothers and romantic and being a romantic companion and a partner. It brings to mind Love is Blind. I don't know if any of you watched Love is Blind UK, but there was a contestant on there who suffered from endometriosis, and she felt that it was important to highlight how she struggled to feel like she was worthy of being a mother and a wife or a girlfriend, because of the fertility issues that she had. She felt like she wouldn't be able to complete that role, and so she was a bit reluctant to seeking out a partner. Another, facet of discrimination that women experience is being judged and, being shamed for struggling with their weight. One of the many things that society and men love to do is to speak on women's weight, and likewise, we as people love to speak on women's on weight in general, whether it be men or women, but women always get the brunt of their weight being highlighted and being made a topic of discussion. And a lot of the time, people who do that are not well educated on some of the experiences that women are going through, specifically dealing with a reproductive disease that makes it hard to manage your weight. So these are things that we need to be mindful of, especially, you know, in our community and in our social groups. When we speak on people's weight, we need to be mindful that there are things that they are struggling with behind the scenes that is making it hard for them to actually deal with their weight and manage their weight, you know, on a daily basis. And we also, you know, in the previous presentations, Dr. Charles and Jolie highlighted, you know, some of the physical symptoms and consequences of PCOS, including acne and excessive hair growth, definitely impacts how women feel about themselves. So we're talking about their confidence, their self-esteem, when it comes to their physical appearance, that is negatively spoken of and highlighted. And, you know, that also contributes to women feeling unworthy and feeling like they're not able to be themselves because they're struggling with this disease that is making not only causing internal struggles, but also the external is highlighted. And to be compounded with judgment and with shame is really not the way that we should look at creating and enabling a safe space for women struggling with PCOS. Next slide. And of course, we have heavy periods and chronic fatigue, which also contribute to struggling with this disease. It's important for us to celebrate our differences rather than creating this stigma around women that are living with PCOS. I think a lot of women are dealing with now having to empower themselves, knowing that, like Dr. Charles said, this is a lifelong disease that they will have to struggle with. And so it's required that they create this new normal where they have to love themselves despite the reproductive issues that they are struggling with daily. And when we are in community and we have people around us, it's also important for them to celebrate the differences, or rather the new normal that that we are also struggling with. So how do we create safe spaces for women living with PCOS? We have to, you know, understand that reproductive issues vary from person to person. Some people struggle with more than one. And so the impact on their bodies and on their lives is twice the amount as somebody who's struggling with just one disease. But we have to understand that constantly stigmatizing women about their health negatively impacts the experience that they're already having, and it makes it worse because a woman wakes up every single day knowing that the things that are happening and changing within her body are already happening. So for somebody on the outside to now highlight this, it's like, I already know this, and you know, attaching that stigma to me then makes my experience even worse. And we have to be cognizant of that and rather embrace that, you know, women are going through a tough time. And a lot of women are coming up with reproductive issues more than we know. So we have to be conscious of how we create that space for women and we celebrate women, keeping in mind that it's not like how we used to like what we know to be before. Women are now dealing with a lot more issues when it comes to their body, and that needs to be incorporated in how we approach them and deal with them on a daily basis. One of the things that stigma does is that it leads to severe mental health, you know, issues such as anxiety, such as depression. And this is an additional stress that is added to the body aside from having to deal with reproductive issues. I think it's important to highlight that anxiety and depression are a stressor on the body, and stress is one of the leading killers, if it's not, of people everywhere. So having to deal with the additional stress that anxiety and depression will have on the body, in addition to your reproductive issues, it does not create the best space for women. So we need to now understand how we can embrace and remove these things from our interactions with women, and rather enforce positive interactions and create spaces that are important, that enable women to feel comfortable within their bodies and enable them to be more confident and to have higher self-esteem when they're dealing with issues like PCOS. Next slide. A safe space, what does that look like? A safe space looks like, you know, a space that provides an avenue for women to feel seen, to feel heard, to feel understood, to feel considered, and to feel comfortable. And that can be embraced in many different ways. On the granular level, where it's within your social circle, it's within your family and friends, and also on the macro level, at the policy level, at the legislative level. There are so many ways that we can make changes within our society that embraces the fact that a lot of women are struggling, a lot of women are having difficulties because of the reproductive issues that they are facing. One of the ways that I can think of in terms of at the policy level is, mandating the importance of providing sick leave and providing time off for women that are struggling, with diseases like PCOS. I think Jolie highlighted that, sometimes it's difficult for her to go to work because of her disease. And that impacts, your productivity. But if policy is in place that helps, the institutions that we work in and work with, help them understand that, these things need to be put in place, not just having these conversations, but within your workspace and within your work policies and within your work practices, embracing the fact that the people who work for you are human as well, and they struggle, specifically women, struggle with reproductive diseases that will require a day off, or will require a week off, or will require some additional adjustments within the workspace to accommodate, some of the issues that they're dealing with. Simple things like making it mandatory to have sanitary napkins and these types of things at schools for girls. I went to an all-girls school, St. Joseph's Convent, together with Jolie, and I'm not sure who else on here went to convent. But I can't say, and I stand corrected, I can't say that, these products were readily available at school when we were there. But I struggled with my period, and I still had to show up to school every single day, even if my flow was excessive, and I would have to, make sure that I'm going to the bathroom to change all the time. And I'm at an all-girls school where, I feel like the environment should embrace the fact that all of us here are probably getting or will get a menstrual cycle. And some of us, if not all of us, will struggle with our cycles. Not every single one, because some women don't have those issues. But these are some of the things that can be, instituted and changed to ensure that we create this inclusive environment for women, not only recognizing the natural processes that they go through, but also recognizing the additional issues that a lot more women are struggling with. Within the workplace as well, there should be an enforcement of some of the hygiene and hygiene products and some of the things that women need to feel comfortable whilst they're at work, and that will encourage and embrace them being a lot more productive whilst they're at work. Additional things to include patience and creating partnership within, our circles, educating our circles, as was highlighted before, ensuring that they know, but also understanding that we need to enforce that our circles recognize that they too should take on the responsibility of understanding, some of the struggles that women are going through. It's not just our responsibility to educate them, but if you want to learn something, and if you want to make a better place or make a better environment for women to feel supported, then you too take on that responsibility of educating yourself so that you could contribute to making a more inclusive and a more comfortable environment for women struggling with these diseases. Next slide. And so what is a safe space for women with PCOS? What does that look like? It looks like focusing on women's overall health rather than their fertility. Their fertility is not the be all end all to their value, rather their overall health is. And so that should be the highlight of your interactions and your conversations with women that are struggling with PCOS. Avoiding comments on appearance, especially weight gain, facial hair, and excessive facial hair and hair growth, and any other sign, acne, scars that would negatively impact a woman's confidence and her self-esteem. And so replacing these negative comments with words of support, love, and encouragement, and avoiding criticism and judgment. The world is already a negative place, and we should make it our responsibility to be kind and to be encouraging and to support and to love the people around us, especially the women around us that are suffering with reproductive diseases. Educating ourselves, like I said, on women's reproductive health and illnesses. It is not just the responsibility of women to tell you the struggles that they're dealing with, but you too take it upon yourself to understand and to educate yourself. And of course, enacting policy and legislation which provide proper healthcare support to women. This is very, very, very important. It makes the lives of women much, much easier. It makes the life of the healthcare fraternity much, much easier. And I'm sure Dr. Charles could attest to how policy and legislation could definitely improve on how she interacts and deals with her patients. So all of these work together to provide a safe and loving environment for women with PCOS, but also creating this new normal of understanding that women are going through a lot, especially the women who are struggling with these diseases. Next slide. And so, diseases don't have a face. They don't have a race. They don't have an age gap. They have no occupation. Everyone has to play a role. Everyone has to take on that responsibility in creating that environment for women. Next slide. And so how do we build strength, in sisterhood? How do we encourage, and how do we bring everything that we've spoken about today together to foster this environment? We have organizations like Iron Womanhood that are, adamant on creating this community for women that are suffering. We're having these conversations like what we're doing today, and we're sharing resources, we're sharing our experiences, we're sharing our doctors, we're sharing our medicine, we're sharing our knowledge. All of this working together will continue to build on the community that we want to see, come to life when it comes to women suffering with reproductive diseases like PCOS. And that means, you know, and when you leave here today, you reach out to the people you know that are struggling and you ask them how you can support them. You share the resources that you have, share Ayanola Womanhood with them, and encourage them to look into, you know, community and women that are also struggling and also willing to provide that support that they need, but also highlighting how you want to be more of a support in their lives, how you want to have these conversations with them, how you can connect them to resources that will probably alleviate some of their struggles, and how you want to be a better part of their community. So thank you. I think that's the last slide. And I hope we can continue to encourage and support the women around us who are struggling with PCOS.
Yes, thank you so much, Beverly Ann. I definitely enjoyed your point of view, your presentation. I cannot believe you were worried about presenting. Your slides were beautiful as well as insightful. So thank you so much for taking the time to present and just talk about your experience with PCOS, but as well highlight the experiences of other women and girls who are going through the same thing. And hopefully we can see some change taking place in our schools, not only in St. Lucia, but in the Caribbean, when it comes to just menstrual health and periods and educating people, as well as having more resources available. But now I think it's a good time for us to applaud, well, virtually, all of our presenters from Jolie to Dr. Charles and obviously Beverly Ann. So can you please applaud? Thank you. They gave us some wonderful presentations. So, so wonderful, so insightful, honestly. Yeah, hopefully you'll feel appreciated. You can feel the love from the sisters. Okay. And now let's turn to Vice President of Ayanola Womanhood, Miss April Louis, before we start our question and answer segment. April.
Okay. Good afternoon. Can you hear me?
Yes.
All right. Good afternoon to the esteemed hosts, panelists, and of course to you, the audience. I am April Louis, and I'm the Vice President and co-founder of Ayanola Womanhood. And I would just like to say thank you for joining us today. So Ayanola Womanhood is a woman-created, woman-led, non-profit organization. And our mission is to raise awareness and advocate for women living with chronic reproductive illnesses, such as fibroids, endometriosis, adenomyosis, and of course, polycystic ovarian syndrome, PCOS. So if it has not been made clear as yet after these three excellent presentations, I am just going to beat a dead horse, to use the proverbial saying. Why do we raise awareness? Why have we made this our mission? Why have we created the events and that you have very graciously attended today? We raise awareness because we understand that there is inadequate time and effort allocated to teaching everyone about women's reproductive health and disorders, and in this case, PCOS. We raise awareness because despite the frequency of PCOS, we heard Dr. Charles speak about frequency. For every 10 women that you know, at least one woman may have PCOS. Despite the commonality of this disorder, there still exists rampant ignorance and its negative side effects of stigma, discrimination, and prejudice. So therefore, we raise awareness to equip people with accurate knowledge and to engender respect, empathy, love, and grace for those living with this illness. Hence the title of today's webinar, Embrace and Empower, Creating a Safe Space for women living with PCOS. We hope that in today's presentation that you would be empowered because as Beverly Ann explained, in order for us to embrace women living with PCOS, we must empower ourselves with knowledge. So our purpose as an organization is that even before we have others create a safe space, is for us to create a safe space for women such as myself who live with PCOS. We want that these women inhabit a world that lifts them up, encourages them, and sees them for who they are and not how they may appear. So once again, thank you for joining us, and we are looking forward to your comments and your questions. Thank you, Melanie.
Yes, that was our beautiful sister. April, thank you so much for your remarks. And now we're going to get into the Q&A. And we have a couple of questions coming from Alma. And the first one, I believe, was to our first speaker, Julie, about what treatment options have you tried? Julie, do you want to get on the mic to respond to this one?
Sure, thank you very much for the question. In terms of treatment options that were given to me by my doctor, I have not used any as yet. They have not given me anything as yet. And I am not sure if it's because I had a baby very soon after getting diagnosed. So it was only 2 years after I got diagnosed that I had a baby. So the concern thereafter was more on birth control than anything else. But at home, sometimes when I experience very bad periods, I would use just the herbal and the natural remedies that our grandparents and our parents often recommend, like the turmeric and the ginger and the bay leaf and so on. But nothing in terms of medicines.
Thank you for your response, Julie. And yes, our local medicine, our bush medicine always works wonders. So thank you for sharing these at-home remedies with us. Alma, I did see your second question, but I have a response for you, which I'll share towards the end of our session today. And the second question, which I have, is for Dr. Charles. Hopefully, Dr. Charles is still on the call. You spoke a lot about not having patients go through certain tests because of the high cost associated with it, as well as the costs for different psychologists and nutritionists, getting access to vitamins and more. So I just want to know, what is the economic cost of PCOS? More specifically, how much money do people typically spend once diagnosed with PCOS?
Thank you. Before I get into answering your question, I just wanted to highlight that while our herbal remedies play a role, I think we must be careful with some of them, like the turmeric. In as much as it has anti-inflammatory properties, it also has anticoagulation properties, so it can cause bleeding, increase the chance for heavy bleeding. So a woman who is already experiencing significant heavy periods, if she is constantly taking turmeric or the chichima in our Creole, she will bleed more. So just be careful with some of those local remedies. Now, as to the economic burden, I mean, I've not done a cost analysis of it, so it wouldn't be fair for me to try to put it in figures. But I can say, a visitor is generally what, 200, 250 if one is going to a specialist. And then, of course, additional tests with, Mount But it's just over the years of having to stock up on pads and probably missing work and having to get those medications to either control the bleed or to help with the fertility or to help with the acne and the hair, or if one ventures out into seeing these additional support systems like your nutritionist, which is not very typical, or having to see the dermatologist, of course it would increase. So the economic burden, when you look at World Health Organization, they speak about billions, you know, being pumped into trying to help manage women with reproductive issues and PCOS. So I imagine it's expensive. I just want to say that when I speak of not sending, it will be for those women who already fit the criteria. So when I said 2 out of 3 things, if she comes in with the history of the irregular periods or the difficulty getting pregnant, with the clear-cut signs of the high androgens like the acne and the facial hairs, then there's no big need to send her to do additional things. More so if she has an ultrasound which shows multiple little eggs in the ovaries, then that's sufficient. The LH and the FSH generally comes back normal. I've seen women come with a barrage of tests and they're all within normal, yet they're still having the clinical signs. But yes, it is costly, both from an economic but also from a social and psychological standpoint. I hope this gives you some sort of insight, but I can't say, well, I've done a cost analysis and it will cost every woman about $1,000 or $1,500. It is costly though.
Yeah, well, thank you for breaking that down for us, as well as telling us and giving us some warnings about our natural medicine. Thank you very much, Dr. Charles. And to all of the speakers, there's one question that I would like to know. It's how do you deal with the mental and psychological effects of PCOS as well as other illnesses associated with menstruating people? Because I heard a lot of you speak about, going to psychologists or having to have these discussions with your partners and your loved ones. I just want to know, can you give us some insight into that if you feel comfortable, and share it with our listeners today?
Well, like I said, I don't personally struggle with a specific reproductive disease. However, I do have, and from the time I've known myself, struggled with heavy periods, like really heavy periods. And if some of you know, like, will go through your clothes, or you're sleeping at night, wake up in the morning in like a big red pool. Um, but these are some of the things that I know I've struggled when it comes to, my menstruation. And some of the things that have helped is exercise. Luckily for me, I was an athlete most of my childhood, so it kind of transferred into adulthood, and that has helped me maintain regular periods. For instance, if I do exercise on the first day of my period and I don't like rest, the rest of my period is much, much lighter and better. If I make the conscious effort to continue going to the gym or continue going outside for a run or exercise when my period comes on, then that lightens the flow. And of course, eating well and prioritizing eating well, which I don't do, but I think would be a key factor in seeing a change in my period. So I would encourage women to really prioritize diet and exercise. I don't think it could be stressed enough in terms of just, overall health, but also I think it would be a great factor in terms of reproductive health.
Thank you very much, Beverly Ann, especially for talking about the exercise part. I think exercise is usually the response to a lot of things. So thank you for reminding us of the importance of that. And I see that Jovi, hopefully I'm pronouncing that correctly, in the chat asked the question, are there any known PCOS specialists in St. Lucia? Probably Dr. Charles or somebody that would like to answer this one.
No, I'm not aware of any PCOS specialist. That would be nice, but we're missing so many things in St. Lucia. I don't know that we'd have a PCOS specialist anytime soon, but we do have gynecologists who are well versed, as well as general practitioners. We have persons who have done, further studies in endocrinology, like Dr. Nasha Charles, and I think we have a fairly good understanding of the condition. And I think for the most part, persons are reasonably, I would say reasonably. I think my biggest challenge with managing women with polycystic ovary syndrome is in them understanding how significant it is to change or manipulate the lifestyle choices. I think that's that just as Beverly Ann is saying, it's not easy. So I don't pretend that it's easy. And I say to them very, very early in the conversation that I'm not going to pretend that diet control and exercise are easy things. It might be easy for some of us. Some of us are just hardwired that way. We are very disciplined. We measure our portions. We can say no to that extra piece of cheesecake, or and some of us just can't. We have a thing for food, and there's so much food available. We're not a starving society, and then exercise is challenging. If you're looking at it through gym or whether it's walking, persons may feel enthusiastic at the beginning of the year, and by the time we're halfway through January, that's it. So it's not easy. But that's why I put up the Rolls Royce, that pink Rolls Royce on one of the slides, that we are machinery. And every machinery demands a certain fuel, and our fuel is food. That's one of our biggest fuels. And I have seen where women came in with a lot of the symptoms and signs for PCOS, but once they made a decision to control how much they eat and the quality of the food, we live in a society like a day like today, Sunday, the plates must have at least 4 starches. That's classic Caribbean food. We must have a little rice. You cannot go without the mac and cheese or some macaroni something. And then, some sweet plantain, potato, breadfruit. These days, breadfruit in season. And then they have to fling in a little something, a little fried plantain. So in that one plate, it looks good, but it's plenty starch. And then we have a tendency to just overeat because today's Sunday and we've worked hard all week. And then when we're done, we wash it down with a good glass of juice, nice and sweet. Maybe golden apple is in season, and we take it down and we lie down and we say, well, I feel like a little something in my mouth, and we eat a little cake or something. And that's how a lot of us eat. We buy food from out there. So that is, if we manage this, I have seen women who come back with a big smile because their objective of the pregnancy is fulfilled because they did that correction. I had a lady stop me in the parking lot recently, a big smile. She had come several times for abnormal bleeds. Does not want to get pregnant. So that's not her focal point, but her focal point, she's tired of those bleeds. And she came with a big smile and said, Doc, I finally get it. I stopped eating this, I stopped eating that, and now everything is. And I said, this is what it is. If you can just stick to it, you will see a difference, because diet is everything. Our fuel is everything. If that was not so important, believe you me, we wouldn't be telling diabetics and hypertensives and people with renal conditions to, manipulate the diet. It is one of the most significant changes, but it's difficult. So we don't have the PCOS specialists, but we do have a lot of specialists in the patients themselves who have their own experiences, and they've done the readings, and they have a fairly good idea as to what to do. The question is, can they do it? Can they stick to it? Consistency makes a difference. If we can get people to be consistent, we'll see some changes.
Thank you, Dr. Charles. But I think I have to keep you on because I see a question from Stephanie, who asked the question. I recently read an article showing that the prevalence of childhood adversity, trauma being significantly higher in women with PCOS. We also know that these ACEs are significantly associated with negative mental health symptoms. Do you think it would be helpful to adopt a trauma-informed approach when documenting patient histories, particularly for women with PCOS and other reproductive challenges? It was a bit long. It's in the chat if you need to read through it.
I saw it, and I'm glad that the individual raised the issue, because as I prepared for this presentation, one of the things presenting does is that it also educates you, the presenter. So, I don't just sit here and I say, well, I know PCOS. I go back and I read. And it's amazing how the narrative continues to change on PCOS. So yes, these stressful childhood situations and ongoing adult stressful situations, the pandemic, all the crime that is festering in St. Lucia, these not singly, not all, not on its own, but collectively can lead to a woman developing hormonal issues, because we're hormonal. I always say to women, I will create a bumper sticker that says, be kind to girls. We are hormonal. We are hormonal before we even know it. When those breasts start to bud, when the periods come, we are hormonal when pregnancy occurs. We are hormonal when the menopause occurs. And we are constantly roller coastering through those hormones. So everything impacts our hormones, and our hormones are everywhere from the brain all the way down to our skin. And so it is that point makes a lot of sense, because as I looked at more recent literature on PCOS, they did speak to stress being a significant component. So yes, in the discussions that we have with patients, these are some of the things we need to extract. Of course, it comes with sometimes more than one visit, because sometimes persons are not ready to open up about these experiences. But I think all of us can give a story of something that triggered some sort of trauma. For me, it was being in school and being told, being on the lazy side of the class and being told that, we on that side would have amounted to nothing on a daily basis. Well, I'm glad I amounted to something. But when things like that, are said to children, or maybe in the household where there's a lot of intimate partner violence, there's a lot. Every day we are dealing, even now, I am dealing with the trauma of the potholes. Every day I am going down in a deep pothole. So, I mean, we're dealing with trauma. But you see, we are also learning to admit that as humans, just as we can get a scratch on the skin, we can get a scratch on the psyche, on the mental health, and we just need to deal with it and speak about it. And the platform is there for it. So that's a very good point. Very, very good point.
Thank you, Dr. Charles. And I'm sorry, I have a question again specifically for you, asked by Robin and one of our sisters. And she asked the question, can Dr. Charles recommend some supplements that will help our sisters manage their PCOS, or speak more on the importance of vitamin D and magnesium, also on the overlap of endometriosis and PCOS?
Okay, so I always say our biggest supplement is what we put in the food. So you can take all the magnesium and all the vitamin D. If you're sitting there with your Sunday lunch as high as this, plenty of carbs, you will undo that. So your first supplement is in recognizing that you need to be selective. You need to be picky. The same way women are very picky about their face. People take time to put on their lipstick, and to put on the little eyelash and make sure it looks perfect and every hair is in place. We must be very selective about the quality and the quantity of foods that we put in. And that's the biggest thing. And then, of course, we can add in some magnesium, which is very helpful in a lot of the processes. And it's not something that you could just pick up and say, well, I'm eating some magnesium. So a little magnesium supplement, a little vitamin D. We live in the heat, we live in the sunshine, but most of us run away from it. I mean, most of us are sitting in offices, so we're not out in the sun working. And so a little bit of vitamin D. I don't say on a daily basis, again, because it is a lot to have to every day pop in some magnesium or pop in some vitamin D. But if you, on most days, eat healthy, then you can bring in a little bit of those supplements. But I want to say that these supplements on their own will not fix the polycystic ovarian syndrome. It will not fix the endometriosis, which is also very inflammatory. It has a huge. component. And what else the person wanted me to speak about? I think somebody said endometriosis and something else. But a
Yes, so
lot
the
of
overlap between endometriosis and PCOS.
so these are two distinct conditions. But what overlaps is that it comes down to diet. I think again, diet and lifestyle. When we look at treatment options, you will see high up for PCOS more than endometriosis. First line treatment is adjusting what you choose to put in and how much activity you choose to do. And endometriosis comes down to managing all the other symptoms. A lot of times it's hormonal manipulation, but diet plays a huge role. Diet plays a role in everything. There are persons who will tell you they got cancer, or they got kidney issues, or they developed diabetes, and just because they selected what to eat, how to eat, what to do, juice this, take this, eliminate, they were cured from the condition. So the fuel is everything. I don't know how else to say it, but people say to me, well, doc, I'm a foodie and I love my food. And I say, well, it comes down to what makes you happy and the consequences, and if you're able to deal with the consequences, you know. But the overlap is really this. These are two distinct conditions. Endometriosis represents, my new analogy for endometriosis is eyes that we have hair are also found everywhere else. Imagine a condition where your two eyes that you have hair, you also have, you know, replicas on your shoulder, on your breast, on your belly, on your foot. And when you cry, these eyes in these other locations also cry and wet up your clothes. So endometriosis is like this. The lining of the uterus, which should be the only place that sheds when we have a period, is found other places, and it also sheds when we have that period. So whether that tissue is found on the ovary, on the bowel, on the navel, in the brain, in the lungs, on the liver, it also bleeds and leads to a whole host of other issues. So there's a bit of overlap, but these are two distinct conditions.
Yeah, thank you for breaking that down for us, honestly. It's been so great listening to you as well as the other participants speak and just speak so candidly about their experiences, as well just about women and how we've been treated in society, as well as other menstruating individuals. So I'm so glad that I've been here with you today. But before we officially end things, we're going to have a closing remark from Ayanola Womanhood's treasurer, Miss Zola Daniel.
Okay, thank you. Hope you all can hear me. I would like to say it was a very insightful and engaging event, and it is my great pleasure to extend my heartfelt thanks to all who contributed to the success of this webinar. First and foremost, I would like to express my deepest gratitude to our distinguished panelists, Dr. Charles, Ms. Pistol, and of course, Ms. Hippolyte. Your presentations, they were indeed insightful and enlightening, and it offered me a very diverse perspective on the values of, just being a woman and PCOS. To our host, Ms. Jacobs, for guiding us through a seamless event. You are definitely a remarkable host. To our wonderful audience, your participation and thoughtful questions during the Q&A segment, they were definitely very insightful as well, and it made the webinar very interactive and engaging. Your presence and attention, they are deeply appreciated. And last but definitely not least, I would like to say a special thank you to Miss April Louis, who is our amazing Vice President, for all the behind the scenes that she does for the organization, for working tirelessly to ensure that this webinar was executed superbly. Your efforts do not go unnoticed, I must say. And once again, thank you all for being here, and we definitely look forward to seeing you in our future events. Thank you.
Thank you, Zola. But before we head out, everybody, please turn on your cameras so we can leave with a wonderful screenshot of everybody for your participation today. I know not all of you want to, it's probably Sunday and you're probably like, washing your hair and stuff. But we need to have a picture for us to remember this moment. Come on. So are you gonna take a screenshot? Am I gonna take a screenshot? Dr. Marissa Jacob Leos, where are you? That's my sister, everybody. So that's why I'm being troublesome. I see Kira. Is that everybody? We're okay. It's all right if you
And
don't want to.
I can
It's all
take the
right.
screenshots if
Yes.
okay. Say cheese.
Cheese.
Okay, everyone looks really happy. Oh wait, I missed Natasha. So one more time.
Yeah, Natasha came on.
Okay, cheese.
Cheese. Yeah, Joby.
Okay. Thank you, everyone. I'm going to have another shameless plug. Just a reminder about our I'm going to plug and I can't find the. Just a reminder for our different activities, PCOS Awareness Month is far from over. So we still have at least 2 more events. And the first one continues until the end of September, and that is Wear Teal for PCOS. For those of you who may not know, teal, the teal ribbon is the official color and symbol for polycystic ovarian syndrome awareness. If you do not have something that is exactly teal, we'll make it work. Please share your pictures, tag us in them, DM them to us. The different sisters, I know I do, we do appreciate when people show solidarity. Also, next week, Saturday, upstairs at Report Plaza from 10 a.m. to 3 p.m., we're going to have an informational pop-up where we're going to just share information about PCOS. You can speak to other PCOS sisters. We will have keyrings on sale, stickers, and as well, we're going to have a visit from Charlotte Byrne. I am so sorry, Charlotte. I feel like I messed up your surname. And she will be available from 1 p.m. And she's offering the chance to win PCOS management consultations. There will only be 2, and weight management consultations only 2. So please show up as early as possible to get a chance to get these consultations, or if you know anybody else who has PCOS who would be interested. Thank you.
Yes, thank you, April. Thank you once again, everyone, for joining us this Sunday afternoon. Thank you to the presenters for putting together such interesting, thoughtful, amazing, insightful presentations. Thank you, Ayanola Womanhood, for creating this amazing community and giving all of us a space to share our experiences in a meaningful and positive way. Thank you so much for taking the time, everybody. Please enjoy the rest of your day. And I'm going to go to bed now.